Mkutano wa kwanza wa kitaifa wa kujadili na kutathmini hali ya saratani nchini ukiwa umeratibiwa kufanyika tarehe 2 hadi tarehe 4 mwezi Februari mwaka ujao. Takwimu zinaonyesha kuwa visa vipya 1047 viliandikishwa mwaka 2021 huku visa 1042 vikiandikishwa mwaka 2020 sawia na vifo 1027 mwaka huo.
The National Cancer Summit, as the word says, summit, is going to be a forum for all of us to get together, to bring our views, to bring our voices, to bring our experiences, our knowledge and skills, harness them together over 2 days, and come back and say, this is really what the Kenya people want for better lives for cancer. This is the blueprint.
Cancer remains a major public health concern in our country. It's the third leading cause of death in Kenya. In 2020, the country reported for 2,000 new cancer cases and 27,000 cancer-related deaths.
Saratani ikiwa ya tatu kwa wingi wa vifo nchini, aina 5 za saratani nchini zenye idadi kubwa zaidi zinaongozwa na saratani ya matiti, saratani ya uzazi wa kike, saratani ya kibofu cha mkojo na saratani ya koromeo. Vifo vingi zaidi vikitokana na saratani ya matiti na ile ya uzazi wa kike. Taifa la Kenya likishuhudia ukanda wa saratani ya koromeo unaoathiri eneo la magharibi na bonde la Ufa.
These 5 cancers account for nearly 48% of the cancer burden in the country. Notably, 9 in every 10 persons with esophageal cancer will succumb to the disease.
76 people dying of cancer every day, 76. That means that we are losing many lives every day. But behind each of those lives is a family, is a business, is a community, is a country's socio and economic development. So for us, one of the biggest things that concerns us is 2 out of every patient who are diagnosed die in the year of diagnosis. This is because majority of them are diagnosed at a late stage.
Takwimu zikionyesha 2 miongoni mwa wagonjwa 3 wa saratani hufariki kutokana na kutambulika kwa maradhi hayo yakiwa katika hatua isiyoweza kutibika.
5 cancers account for nearly 48% of the cancer burden in the country. Notably, 9 in every 10 persons with esophageal cancer will succumb to the disease. Currently, the majority of persons diagnosed with cancer will succumb to the disease since approximately 70% of the cases are diagnosed at advanced stages when cure is almost impossible.
Shirika la bima ya afya ya taifa NHIF likigharamikia wagonjwa wa saratani kwa kima cha shilingi bilioni 3.8 kila mwaka na kuharamia takriban shilingi milioni 1.6 kwa kila mgonjwa wa saratani ikiwemo matibabu ya kemo.
All those people, 47,000 unique individuals last year that NHIF helped, and we're not talking about the enhanced schemes because those have been paid for by their employer, ordinarily would not have been able to afford that. And I'll tell you for a fact, it doesn't matter which part of the world, no one can carry the cost of healthcare on their own, and especially with issues like cancer. Even with those benefits, when you look on average how much we pay for a cancer patient, it's close to about 1.5, 1.6 million when you look at those packages. That is even a benefit that most of the private insurance would not even be able to provide because everything is capped to small limits and sub-limits.
Wito umetolewa wa kuwahamasisha Wakenya kujitokeza kufanywa uchunguzi wa kiafya, kuanza matibabu mapema pamoja na njia mbadala za kuwapa matibabu ya rahisi mashinani ili kukabiliana na jinamizi hili.
When we are talking about this cancer debate, really our discussion starts there, that in the first place we ensure that we limit the number of people who acquire cancer, who get cancer, and this really is embodied at the programs that counties are doing at the community level, that we put a lot of stress at the primary health and at the community level to educate communities to ensure that there are safe products, working closely with different national government agencies, so that in the first place we reduce the number of people who acquire cancer.
Align the summit to coincide with the commemoration of the World Cancer Day. So with this in mind, we are working with our stakeholders and our partners to ensure that similar services are available across the county so that whatever is happening within Nairobi is also replicated within our various counties.
What can we do to ensure that we prevent cancer? First, what is it? What research do we need to have to let us know that these are the things we need to do to prevent cancer? So we have academia, we have universities with us. We need to also find out if the cancer is not prevented, how do we discover it early enough? That's where we are talking about screening. And screening is a key role of the county government with support of policy infrastructure from the Ministry of Health. How do we enable screening very early so that the cancer is discovered at the earliest stage when it can actually be treated and give the person the chance at a full life?
Willy Lusige, KTN News, Nairobi.